Hi there folks, this is Matt Scalise, Doctor of Physical Therapy, McKenzie Spine Rehab Specialist, and Orthopedic Certified Specialist. The purpose of this video is to give you alternatives to flexing the low back during your daily tasks. By repeatedly rounding the low back during your daily activities, you expose the spine to unsafe levels of stress. You increase the likelihood of sustaining a low back injury, and you delay recovery if already in the midst of having low back troubles. So let's demonstrate and then talk about the lifting strategy called the hip hinge. So the hip hinge is a good strategy to use when you're working at a height, roughly the height of your hips. So when you need to get yourself forward, as if brushing your teeth, washing your face, doing the dishes, you don't want to round the low back, but rather hinge your hip in this backwards direction. I like to use sport analogies so that patients could remember these different lifting strategies. And the sport analogy for the hip hinge would be a golfer getting set up ready to putt. So the hips travel backwards, keeping the back in a straight position. You utilize the hips to get where you need to go, but still keeping the back in this straight position. It's very important to brace yourself if need be. You could stagger your feet in different directions to get leverage depending on what you're doing. But the basic premise remains the same, that as you get yourself forward, the hips travel backwards. So the hip hinge is an excellent strategy when from a seated position you have to do things in front of you, as if rummaging through a purse or a cabinet or a drawer. Too often what people would do is round their low backs forward in this position. With the hip hinge, a better strategy would be to get yourself into this position as you're going through that drawer or that purse. The hip hinge is also a good strategy when getting up from a seated position. Again, too often what happens is people's first instinct is to round their low back when getting up from a chair. A better strategy would be to get themselves forward. I like to tell people to kind of go at a 45-degree angle and have an upward trajectory of 45 degrees. So you lean forward and you come up into that 45-degree trajectory. So the hip hinge is a good technique also when having to pick up a heavy object from the floor. Too often someone would round their low back to pick up the heavy object. A better way would be to allow the hips to travel backwards, keeping the back as straight as possible, bringing that object onto your leg as you then bring your hips forward. So the hips go backwards and the hips come forward, always hinging at the hip. So some key points to remember with the hip hinge. You could utilize a hand or an elbow to bear some weight and offer some support when you're doing the technique. Or you could stagger your feet to gain a little bit better leverage, whether or not you're chopping something or polishing something. The main strategy remains the same. Hips are back, back is straight. So once again, this is Matt Scalise, Doctor of Physical Therapy, speaking on behalf of the Global Exercise Group.